Hi guys, so it's a new week and definitely a new video, and so you're welcome to All Round Health Talk. As usual, my name is Dr. Onyinye and with me is
Dr. Celestina.
Okay, so we realized that last week we shook a very big table that had a lot of Nigerians sitting on it. We are glad that our viewers were able to learn the negative effects of abusing antibiotics. So today we're going to continue in line with medication, and we have titled today's topic completion and regulation of your medication. So we realize that doctors are imperfect, and sometimes doctors might make mistakes and give you a wrong medication or give you the right medication with the wrong dosage. But today we're going to focus on our topic on a scenario where your doctor has given you the right prescription. Okay, so for us to be able to talk about completion of your medication, there are two terminologies that we need to understand. And these terminologies are adherence and compliance. Now, adherence is a situation in which you as a patient take it upon yourself after going to a doctor who has examined you, diagnosed you, and prescribed medication for you. You as a patient, you take it upon yourself to make sure that you go out there and get the medication that has been prescribed for you. Or in the case where you have a chronic disease such as diabetes or high blood pressure that requires a lifelong treatment, you as the patient take it upon yourself to make sure that you get your medications before you run out of your medication, so that you don't have to miss any of your medication. Now that is adherence. Compliance, on the other hand, is you taking it upon yourself to make sure you take your medicine the way it has been prescribed by your doctor, be it duration or quantity, which means if your doctor says take it every 8 hours, you have to take it that way. If your doctor tells you take it for 7 days or 10 days, you have to take it that way. And if your doctor says take 1 tablet or 2 tablets, you have to take it that way. So compliance is making sure that you take the medicine the way it has been prescribed, and adherence is making sure that you go out and you get the medicine that has been prescribed for you. Now, knowing this, we need to know the factors that we need to consider when we talk about completion of your medication. Number one is the dosage duration, which we have talked about before. If your doctor tells you that you need to take a medication for a specific amount of days, you need to respect that, because the doctor knows why those medications are prescribed that way. In medical school, we are taught the prescription of drugs based on the type of medication. So that is why the doctors always tell you, you need to take this for 7 days, you need to take this for 10 days. So we need to respect that duration for the drug to be completely effective. Another factor we need to consider is the dosage quantity. Now we need to pay attention to the dosage quantity, because sometimes your doctor might tell you you need to take 2 tablets or 1 tablet every 8 hours. You need to respect that, because the doctor knows the milligram of the medicine and knows why he's asking you to take 1 or 2 tablets. Now if your doctor tells you to take 1 tablet, please don't try to play smart and take 2 tablets instead. You'll be harming yourself. And if your doctor tells you to take 2, please don't try to take less, because at the end of the day, the only person who will be suffering the complications or repercussions of these actions will be you as the patient. Number 3, we need to know what type of medication. We need to consider that, because sometimes the doctors will tell you you need to buy this specific family of medication. For example, in a patient that has high blood pressure, there are different families of antihypertensive drugs. But based on your health history, based on other diseases you might have, based on the color of your skin, and just generally that we were taught in medicine that we don't treat the disease, we treat the patient. So every patient is different, and so your doctor is going to prescribe a family. In this case, we're talking about antihypertensive drug. Is going to prescribe a specific family of antihypertensive drug for you based on certain things he has considered. So if he tells you you need to take this type of antihypertensive drug, for example, if he tells you you need to take diuretics, you need to make sure that you take diuretics. Don't go out there and buy another family of drug. For example, we have those who are those hypertensive drugs that are calcium channel blockers. So if they tell you take diuretics, don't go and get the ones that block the calcium channels. So that's what we're talking about. Respect the type of medication your doctor has prescribed for you. Another factor we need to consider is resistance, which we have mentioned before in our last video. We already know how resistance occurs, what actually takes place when we talk about resistance. So we need to make sure that we do everything possible to avoid resistance. Lastly, we need to consider that drugs can interact with each other, and they can interact with alcohol, or they can interact with food. And that is why sometimes your doctor tells you you need to take a specific medication before food, or sometimes after food. They know why they tell you that, because some medications can be affected by the presence of food. So maybe if you take a medication with food or after food, the food is going to slow down the absorption of that medication into your bloodstream. So it's going to affect the effectiveness of that medicine. So that's why your doctor tells you take this drug without food, take this drug with food. Okay, we need to respect that. Alcohol, so many people take medicines, especially antibiotics, and they go out and they drink alcohol with their friends. Basically, antibiotics and alcohol don't really go well together. So if your doctor tells you don't take alcohol while you're on this medication, please respect that. Okay, and then interactions between drugs, like we mentioned last week, anticonceptives can interact with antibiotics. So there's so many other types of interactions between drugs, and so when your doctor tells you you need to stop this specific medication for now until you finish a particular medication, we need to respect that. So these are the factors we need to consider for us to effectively complete our medication.
Yeah, so the next thing we're going to be talking about is the regulation. Now, well, it's one thing for you to take the drug, and another thing is for you to effectively regulate it. Now, for example, in Nigeria, we're used to taking drug right after eating, and for some drugs that works, but for others not so much. First of all, we have to find out from our doctors if the drug we have been prescribed is actually apt to be taken with or without food. Because as she said, there are some drugs that work best on an empty stomach, and there are some that work best with food. So it just depends on the absorption of these drugs. Secondly, we're used to taking drugs with food, like when they say take a particular drug 3 times a day, we're used to taking drug right after our meals. And that can be very inefficient sometimes, especially if you're not the type of person who eats at regular intervals. Now, we have different methods of drug regulation, but the most efficient in this case would be to take your drug according to number of hours. For example, if you're being told by the doctor to take a particular drug 3 times a day, that means that in a day we have 24 hours. So if you were to take this drug 3 times a day, it means that you would have to take it each 8 hours. I think that's more specific and it's more efficient, because what is the function of this kind of method of regulation? It's to maintain a stable level of concentration of this drug in your bloodstream, because if the level of concentration is maintained in a very steady manner, it is most effective in order to avoid fluctuations of concentration, because this can actually cause reoccurrence of the infection or, well, resistance in some case. Well, for example, I'm going to take myself as an example. For example, I eat breakfast at 8 o'clock, and then I eat lunch at 5 o'clock, for example, for those who work, and then you don't even know if you're going to eat dinner because you're already filled up, or you eat dinner at maybe 7 or 8. Imagine if you take your drugs after the meal. How do you think the regulation is going to be? It's very it's very messy. So if you set this goal as to take a particular drug that you've been told to take 3 times a day, each 8 hours, is more specific that way, and then more efficient. Well, next section is missing a dose. Missing a dose and overdose, because we're humans, we'll always make mistakes, right? And sometimes we don't really remember when we have to take our drugs, and then some people just take it immediately they remember, which would be correct if the time you remembered was actually close to the last dose you missed. But what if you remember when it's almost time for your next dose? What do you do? If you miss one dose and the time you remember is close to your next dose, do not take the missed dose. Just wait for the next time when you have to take the next dose, so that you avoid overdosing yourself. Because if you do that, you are chopping away your life, that's just the fact. So this is what you have to do when you miss a dose. Now, what happens if you miss multiple doses, or if you go a day without taking your medication? In this case, you would have to consult your doctor. Do not take matters into your own hands. Please consult your doctor or your pharmacist. Not chemist though, but pharmacist or doctor. In this case, that's what you should do, please. Next is record keeping. Record keeping is very important because, well, we have our daily activities, and it would be very beneficial for you to carry like a piece of paper or a pocket book where you can write down the times or the specific times when you have to take your medication. This will help you keep better track of your medication, and that way we can avoid problems like overdosing or missing a dose. That is very important. And lastly, safety and storage. I'm sure most of us, on majority of the drugs, the packs of the drugs, we always see keep out of the reach of children. This is actually for their own safety, because we all know how children are. They like to like touch and like eat everything they see. We have to try to keep these drugs away from children in order to reduce the tendency of them picking these drugs and eating them, because this could cause a high level health risk for your children. Imagine if you're hypertensive and then your child takes your drugs and eats them, and sometimes they won't even like to take one, they might take 2 or 3, and then the blood pressure of this child drops this fast. What do you think is going to happen? And the human brain is very, very sensitive to very rapid fluctuations of blood pressure and blood flow. This could make this child have a stroke. It could make this child just die at that particular point in time. So we should be very careful about where and how we store our drugs. Next, temperature. Well, there are some drugs, generally majority of the drugs, we are supposed to store them at room temperature, right? But there are some drugs that, well, they need a lower temperature in order to be properly stored, but majority of the drugs here, room temperature. So we have to be very careful not to store our drugs in places that have high temperature or too low temperature, because it might make these drugs become poisonous to us, because we know how drugs are. They are made up of chemicals, and if they are exposed to certain temperatures that are not conducive for the optimum storage of these drugs, they become practically poison to us. So we have to be careful in order to store our drugs in the best possible place that is conducive for it to actually work best for you. And that's basically what we have for you guys today. I hope you guys learned a lot. And our next topic is going to be, well, it's actually inspired by the theme of this month, October, which is the Breast Cancer Awareness Month. So our next topic is going to be about breast cancer and self-examination of the breast. Yeah, mothers, sisters, daughters, like really, you guys, this is a must watch. Well, it's going to be a must watch because it's actually something that our our people, our population needs to incorporate into their lifestyle. So yeah,
it's a must watch, not just for women,
yeah,
also for men.
Yeah, so
our brothers, our fathers, uncles.
Exactly.
We all have females in our family, so every man has to watch too, for your girlfriend, for your wife, for your sisters. Okay.
Yeah.
Before we go, we had a question last week from a viewer on antibiotics. So yeah, like we said, antibiotics are basically used for combating bacterial infections. There are exceptions.
Yeah.
As always, there are exceptions to every rule. There are certain antibiotics that can be used for fungal infections to parasitic infections too. There are certain exceptions, but generally antibiotics will work better for bacterial infections. The most important thing we need you to take out of last week's video is that you cannot take antibiotics for everything, and you cannot take antibiotics on your own. You always need to confirm from your doctor. Have a test that confirms you have a bacterial infection, and make sure your doctor tells you that yes, you are allowed to take the antibiotics. So really, that's what we need you to know about that. Of course, there are going to be exceptions to those rules. So we hope we've been able to answer that question. And well, thank you for watching.
Yeah, really.
Thank you for sharing. We had people complain that they didn't see sharing options, but we're working on that. You'll be able to share this video. So
we're going to try to
thank you for actually wanting to share it.
Like
that really means a lot to us.
Thank you guys so much.
Okay, so
thank you guys
keep
so much.
sharing,
keep work, keep spreading,
keep
the word
liking,
and everything.
keep subscribing,
Yeah,
keep commenting, keep bringing in the questions, really, because we would like to hear from you all too.
Yeah.
So thank you very much for watching. Oh, we have juice here too. We have lemonade.
courtesy of
Dr. Daniel Abbey.
Yeah.
Some really nice Yoruba guy. He's not Yoruba demon. Dr. Daniel Abbey.
He never reached that level.
He's getting to the Yoruba demon level, but we are working on him. We're going to save him.
Evaluation is still in process.
The lemonade is nice. He likes too much sugar, but this time we are managing it.
He tried.
Okay, so see you
Bye.
next week. Bye.